Welcome to Arogyam Katta. As you all know, heart is a very important organ of the body. It keeps pumping the blood right from birth to death. The moment it stops, you are gone. So to discuss about heart, its elements, as well as its how to keep it heart healthy, we have with us cardiologist Dr. Sandip Rane, and we welcome him on the Arogyam Katta. Dr. Sandip Rane, can you briefly tell what is the heart's role? What does heart do? Why is it so important organ?
Actually, if you give a comparison in life, it is the motor of the engine. Mm-hmm. You know, it's as important as that. The moment the motor stops, the engine doesn't work at all. So heart is central to the function of all the organs of the body. Mm-hmm. It pumps blood, oxygenated blood to various organs, and that's how the other organs continue to work. Mm-hmm. However, our body is always a continuity of all organs. They are connected to each other. Okay. Yes. So any dysfunction in one organ can affect other organs of the body. But central to all the organs is the heart. Which is the heart of the
center stage.
Yes, center stage.
Does any diseases affect the heart? Like suppose jaundice or some other diseases?
Yes.
Does it affect the health of heart?
Yes, it can affect the health of heart depending on the intensity of the disease. Mm-hmm. You know, and there are various types of disorders which are associated with heart problem. You know, we always say heart trouble. But what is important is heart has multiple, or within itself it has got multiple areas. Like there are valves. The valves can get affected because of rheumatic fever in childhood. Okay, if the valves get affected, then you have narrowing of the valves or leakage of the valves. Then there is a heart muscle. The heart muscle can get affected, in which case the heart pumping gets reduced. Mm-hmm. Okay, now this can happen like any viral infection can affect the heart. And that's the reason why the pumping of the heart can come down. Mm-hmm. Then most important is the heart itself receives a blood supply. Oxygen to the blood, which itself is pumping. Now when the arteries, these are called as the coronary arteries. When the coronary arteries get choked up, that is when you have what is called as angina, and when it gets totally blocked, you develop a heart attack. Okay. So it can be a problem in the coronaries. It can be a problem in the heart muscle itself. It can be a problem in the valves. Now the heart itself is encased by a covering which is called the pericardium.
Called a?
Pericardium.
Pericardium.
This pericardium also can get affected. Sometimes in our country we have tuberculosis. Now tuberculosis can can cause a collection of fluid inside the pericardium, and that can affect the pumping of the heart. Or else if you have cancer, then you can have a collection of fluid in the pericardium. That impairs the pumping of the heart. Mm-hmm. So these are the various organs. Parts of the heart itself, different parts getting affected because of different causes.
So it's not only the heart attack. There are so many other diseases.
Absolutely.
Besides heart attack.
One more thing which I forgot to mention was, when the child is in the womb and the mother takes some medicines, mm-hmm. it can impair the development of the heart, and then that is the time when the child is born with heart trouble. That is called as congenital heart defects. I see. So you can have a hole in the heart, then you can have interposition of the great vessels of the heart, that is transposition. Multiple problems can be there. So congenital heart disease, the child is born with heart problem. And acquired heart disease, where you develop heart disease, you are born with a normal heart, but then subsequently you develop.
But isn't it avoidable? Because mother not consuming the tablet if she is aware of.
Yes.
The main problem probably could be the awareness.
Yes, but what happens is invariably, you don't think. Sometimes the diagnosis of pregnancy is delayed. You're not aware that you are pregnant and then you take certain medicines for fever or certain other diseases which the mother has, for which she's taking medicines, and that can impact during the development stage of the heart. So a lot of awareness is necessary. In our country, there's a problem. Mm-hmm. And many females are not aware of which medicines affect the child. Or in fact, sometimes the patient may go to the doctor and the doctor may not take a history whether you're pregnant or not. He treats a primary problem, but that could have an impact on the child inside the womb.
Does this can be detected in the womb at an early stage so that termination can happen? Because having a child with heart trouble,
Yes.
it completely shatters the whole.
Yes. In fact, there are adequate tests now available where you can, in fact, a good sonography can detect heart trouble in the womb itself. And if it's a major problem, see, all heart diseases need not end up with termination of the child. Sometimes suppose you just have a hole. Today a hole can close naturally as the child grows.
Okay.
Only if it's a complex heart problem, then you can go ahead and terminate it. Yeah.
Okay. So that's one risk.
Yes.
Does diet also has any, or lifestyle or diet, has any risk factor associated with heart disease?
You mean adult heart disease?
Yeah, I'm talking adult.
Yes. See, in fact, the lifestyle and diet is very important part in preventing many diseases like hypertension, diabetes, heart trouble.
Okay.
Yes, I think if we follow a proper lifestyle. In the olden days, they used to say that the lifespan of an individual is 120 years. If you follow good lifestyle and follow a proper diet. But unfortunately, and the environment also needs to be good. Today there's so much of pollution around. Delhi is a nightmare.
Yeah.
I shudder to think if I'm staying in Delhi.
Correct. The fertilizers, the food that we eat, maybe have
Today, 14% of the food that we have is found to have pesticides. So the incidence is so high, that can have an adverse impact. Yes. So a good lifestyle and a good diet is very important. It's primary for living a healthy life.
And what about stress?
Stress certainly affects in many ways.
Okay.
Right from getting hypertension, getting diabetes, and getting
I'm talking heart problems.
Yes,
all this leads
to you can have deposition of fat because of stress, or stress itself can cause a rupture of a plaque and it can precipitate acute heart attack.
I see.
Yes. So stress is a very important thing, and I think you need to keep your stress under control.
Okay, so good stress. Now, does the age has any impact? Like as you said earlier, the lifespan was supposed to be 120 years.
Yes.
And I'm sure with aging, what is called as aging, the lifespan may be. What is the impact of aging on the heart? Does the heart also gets weakened with
No, I don't
age?
think. Primarily, the heart should not get weakened with the process of aging. But then, as you age, there are other factors. Like if there's your parents have heart disease.
I'm coming to
your parents.
heredity.
Yes. Then there is a higher probability than the normal population that you can land up with heart problem. And aging, like you have wrinkling of the skin, graying of the hair, certain changes will come up in the heart also, but they will not be pathological.
Okay, so they will not be
Yes. It is your stress, your environment, your lifestyles which add on to your aging process, and then it creates problem for the heart.
And what are the warning signs? Because I'm sure heart attack must be giving some signals before actually. I mean, that's a law of nature.
See, 75 to 80% of the time, you always have some warning signals. 20 to 25% of the time, you don't have warning signals, especially if you are a diabetic.
Okay.
So the diabetics need to frequently check themselves up whether they've got any problem, because they may not have the regular signals of heart disease.
Signals are stopped.
Yes. And what are the signals of heart disease? Like if you're doing routine activity, like say you're walking 1 kilometer, and now you find it difficult, you have to stop, you find it strenuous to walk 1 kilometer. Or if you're climbing 2 flights of stairs regularly, but now after climbing 1 flight of stairs, you feel that no, you are breathless, or you have got some discomfort in the chest. then you should suspect that you are developing heart disease and you should consult your doctor.
I see. Okay. What are the common misconceptions about heart? Because some people say don't work too much, don't do stress, don't do this. I mean, in normal life, to avoid stress in today's time is rather difficult. So even during stress, how to manage heart health?
Actually, heart health, there are a lot of misconceptions and
Correct.
rumors people discuss.
Correct.
And what is important is that you should really know when you are developing heart problem. You should be aware. You know? And what is important is to have a good healthy heart. You need to have a healthy lifestyle in terms of doing routine regular exercises, good nutritional diet, and that starts in the first decade of life, mind you. It doesn't start after you're 40.
After 50, 60.
Childhood मध्ये जे whatever cornice, you have high cholesterol level, genetic transmission असतं, then you need to investigate yourself. Today the approach is nip it in the bud in childhood.
Okay.
And therefore a lot of research is going on in school children.
I see.
To identify heart trouble at an early stage and you prevent it in future. Okay. Then third is, as you say, stress. Managing stress is very important. And what is most important to manage the stress today is meditation and yoga. Yoga starts developed in India itself. Origin is in India.
Correct.
And we have given it to the world. And now people from abroad come and teach us yoga. And they are so meditation and yoga are very cardinal to controlling your stress.
In this stress.
Yes. So I think these are very important things in having a healthy heart. And then once you are, say, beyond 40, maybe once in 2 years, you can get a checkup done. And after 50, maybe on an annual basis, get your blood parameters done, get an ECG done, and maybe a stress test to find out how your heart is doing, how the blood supply to the heart is. So that is how you can identify
identify the...
Yes. And let me tell you, prevention is better than cure. So it is better to be aware and alert as to how to prevent heart disease than to land up with a doctor for curing a heart disease. Because once you are a heart patient, you are a patient for lifetime. Okay. So even if I do an angioplasty or a bypass for you, I postpone your problems by a few years. It will catch up with you after, say, maybe 10 years, 15 years. Okay. So it's better to have a healthy heart, prevent problems, than land up with a cardiologist.
With the heart. I have always thinking, there is a cardiologist, there is a cardiac surgeon, there is a physician, there is a diabetologist. If something happens, whom to go kind of, because earlier the family physician used to send to a right specialist.
Yes.
In absence of family physician and flooding with Google knowledge.
Yes.
What is the scientific method to kind of go to know?
See, I think, the cardiologist is the right person to go to. Okay? First. However, every time you can't be jumping to a cardiologist. The next step where you can go to is a physician. A physician is like a glorified general practitioner. A physician can diagnose your diabetes, he can diagnose heart trouble, and he can take necessary steps to guide you as to how to go further. Generally, what happens is we go to our general practitioners, and by and large, the most important thing for diagnosing whether you got heart trouble is a very simple test called as the ECG, electrocardiogram. Okay. Most physicians, most general practitioners don't have a ECG machine with them. Okay. So therefore, if you are developing a heart trouble or a heart attack, when you first go to the GP, he may give you some medicines, wait and watch, then time is lost. Then you go to a physician, he will take a ECG, he will diagnose that, okay, you're developing a heart attack, now you go and get admitted in a cardiologist. I think if you have got chest pain and you suspect, just go to a nearest hospital, get a ECG done, and if the ECG is showing abnormality, report to the cardiologist. That is the best way of getting treated early. Because, you know, when I was doing my cardiology about 35 years ago, the treatment for heart attack was giving aspirin and giving a clot dissolving medicine. But today, with technology, advance in technology and treatment, the moment you get heart trouble, if you reach a hospital in less than 90 minutes, you're straight away wheeled into the cath lab and you're taken the angiogram table and angiogram is done. If you've got a block there, we go ahead and remove the block, put in a stent over there, and in less than 1 hour and 30 minutes, your block is removed, blood supply to the heart is restored, and you're back to your normal life. So why not take benefit of this technology, which is available in most cities? This may not be available in a two-tier or even two-tier cities today have cath labs, but maybe a district level, you may not have it. There you can go to your family doctor and then treat it. But in a city, I think, where technology and cath labs are every nook and corner, I think you should go report yourself to a center where you can get an ECG done. And ECG doesn't cost too much. But it can save your life. Get your ECG done.
That's
the first and most primary.
First mantra.
Yes.
Okay, now we have been discussing about allopathy for heart disease. This is a heart disease, by the way. Whatever damage done during the attack or post-attack, is it reversible or it's gone?
No, that is precisely what I said. Is if you reach the hospital and if your block is removed in less than 90 minutes,
then probably
the heart muscle is practically saved of any damage. Okay.
So muscle damage is irreversible.
And muscle is life. Is as important as that. So time is muscle and muscle is life. Okay. So the earlier you reach a hospital, the earlier you get initiated for treatment, a heart can be as good as normal. Yes. But if the more time is lost in getting treated and restoring the blood supply, then if certain damage takes place, if the time interval is more than 6 hours and the damage is permanent. Yes. Then that area of the heart muscle dies, necroses and dies. So it is always better to reach a hospital, get treated fast, and prevent the death of the heart muscle. Wherein you can live a normal lifestyle.
Now we have been discussing about allopathic because all what we are talking is allopathic. Does other pathies like homeo or Unani, or does it have a clear solution to heart problem, or allopathy is the only solution?
No, see now, what I need to tell you is the primary cardinal treatment when you're developing a heart attack is to remove the block. And that should be done in as short as 90 minutes. Okay. That is available only in allopathic treatment. If you have chronic angina or pain for a long time, and then or you've got some heart muscle, there could be a role for homeopathy and other pathies. But primarily, I think heart attack, allopathy is
the answer. So viewers, I hope we have answered many of your questions about heart, and we have also discussed about how to keep heart healthy. So Dr. Rane, thank you very much for coming on the Arogyam Katta, and we look forward for some more interviews of yours in days to come.
Absolutely.
Thank you.